go back in, or what do you think? I don't have any preference. I just didn't want to start zooming and muck up.
Uh-oh. Hey, did you ever get the morning sickness yet?
Oh yeah, that was the first time of that.
It's over now? No lingering nausea?
That's not true. Yeah, there's headroom. But I want just a fraction less.
Do me a favor, we put the microphone in the center, because it looks sort of weird.
It's like in your armpit.
Yeah, it looks like a boat crawling into your armpit.
Okay, this is a complex shot. I'm happy to be the sound person when you guys want to put the camera on this one. Just go leave it. Okay. I actually was just filming it. Yeah, so it's like that's what miking out. Just we can have some. Jacob, can you say something?
Can you hear me? Testing?
Yeah.
Nice and clear?
Awesome. Are we okay?
Not too loud. This is God speaking, Eliana. You've been bad. That is the symbol of the devil you just did.
Yeah, I will.
Public health jeopardy. Take this one, Trebek.
So, I guess I could start with the big question. What is public health to you?
What is public health to me? I think public health is a tapestry of all different arts that come together, and sometimes these arts get along and sometimes they don't, but it's everything. I mean, you could see it out in the street, you could see it like one of our partners in the dental clinics, putting fluoride in the water. I mean, you see it in your restaurant, from looking at a grade in a restaurant telling you if this restaurant is a 99% or if it's a 70% and you need to run out the door. It's everywhere in my field. It's industrial hygiene, a little more specific. It's exposure assessments. It's the general deal is protecting the public from danger or hazards.
So I think I know that I don't know a lot about industrial hygiene. So if you wouldn't mind taking us through a day at your job and what kinds of things you tend to see and what you're doing.
Okay. Just yesterday I was doing an exposure assessment for formaldehyde exposures, and this one's a little bit odd for industrial hygiene because we're at a college setting, so it's not typically a commercial industrial hygienist setting, which would be like asbestos monitoring or even some type of other volatile like benzene in the atmosphere. But this one was for formaldehyde from cadavers. So what I had to do was put some it's a passive monitoring badge which collects the formaldehyde vapors on it, and it place it on the person's lapel near their breathing zone. They work and do their thing. It was GSIs, so they were around the body showing students the cadavers and actually taking an exam. So the GSIs were by the cadavers the max amount of time they would be during a day, like a full 2 hours. So it was perfect time, put it on there, and yeah, just watch them. And then I had to get in there. Sometimes I don't get dirty, especially with cadavers, but like try to identify the cadavers, because some are purchased a long time ago, which the formaldehyde would be lower exposure, and some are purchased or newer or embalmed newer, so the formaldehyde exposure would be higher. So it's a matter of getting that data later and modeling that data to see what kind of the curve is of exposure. The worst case scenario on a new cadaver, and then not so worst case scenario on one that's been there for a year or so. So it's kind of different. It's neat. I mean, that's totally bizarre, but it's different every day. I mean, last week I was doing a lead assessment on lead dust from bricks, moving these bricks, which was a pretty high exposure, close to the legal limit. So it's different. It keeps me on my toes.
And what kind of public health leader, when you think about leaders in public health, what kind of person do you tend to think of who you really admire?
I have thought about this. I was kind of pre-thought out on this subject, but I mean, there's all sorts of newer thinking and ways of these public health leaders that have done these, new studies, but I'm gonna have to go very old school, like 6,000 years ago old school, and have to say Moses in the Torah. I think that as far as public health, I mean, there's certain things that existed in like maybe the Egyptian community and things, but I think if you look at the Torah, the first 5 books of the Bible that Moses penned, it was amazing. I mean, he had, for instance, in my field, industrial hygiene, you would think that industrial hygiene didn't exist 6,000 years ago, but there's actually provisions in the Torah that talk about mold, which is actually a new topic of today. Mold is gold in the industrial hygiene world today, like asbestos was in the 80s. Mold today is kind of like the bread and butter of industrial hygiene. And Moses right there spelled it out. If you have mold or mildew in your house, they didn't have bleach back in the day, so what did they have to do when they had mold? They burned their house down to get rid of the mold. So right there, it's like industrial hygiene. Moses, and the parallels are ad infinitum. We can go into epidemiology, the disease outbreak, foodborne disease. Their diet was restricted to things that were more risky, like pork and trichinosis, or shellfish and red tide. All the links to the different food was like an epidemiologist's dream. Yeah, these are the foods to stay away from when you don't know proper cooking temperatures, or you don't have the facilities to measure temperature to cook at 160 degrees per se. And even, I can even stretch this further to health and social behavior for the HSB students in public health. I think that,
So can you pause for a second?
yeah.
Let's go back.
Okay.
And the other thing is, I'm noticing that when your arms are up and you're leaning forward, it's bringing your shoulders
Okay.
up to your head. Yeah.
Okay, put it back.
All right, go ahead.
Okay. And
HSB.
HSB.
Yeah.
Okay, HSB, the link here, health and social behavior. I think the provisions and even the 10 Commandments about having a Sabbath day of rest, not just having an arbitrary Sabbath day for worship, but actually a health provision to having a break in a work week, to having that one day where most communities of that time, they just worked around the clock, to having a stop and a resting period to actually collect yourself and to focus spiritually. And just a day of physical rest had so much physical implications as well as psychological implications of something to look forward to as a break in monotony. So yeah, I mean, I could stretch it to there, and I could probably go in other areas and go on, but I think those are pretty much core that I saw were pretty interesting as a leader in public health.
So how did you come to make the connection between a lot of these older documents and older traditions and public health? Did someone explain it to you that way? Were you somehow made aware, or how did this interest spark for you?
It sparked in reverse. Before I got into the public health field, I was a student of comparative religion, and so I had a background in religious studies and really focused in like Old Testament studies. So I knew all the rules and stuff, and I found them interesting. And as I progressed in science and progressed in public health, those links were backtracked to previous studies I've done, and I was like, it was really like an epiphany. I was like, wow, there's a lot of connection. There's so much truth here, and he didn't even have scientific method. And I just thought it was very clever that without scientific method, there was things that they knew and they discovered, whether it's divine in origin or human in origin. It's amazing either way you look at it.
So what made you take this class? You mentioned a little bit of theater that you've done, and I'm just curious what brought you here and what's the connection with the rest of your studies? And if you could repeat a little bit of what I asked you.
Okay. So the connection for me taking this class and just being here is I wanted to take this class last semester and I couldn't do it because of my required classes, but I've always been interested in video. I've done videos as a high school age with other people, and then made videos of work scenarios and things for other skits, and I always loved it. I always loved film and I loved playing around, mostly through humor. None of my videos I've done were ever serious to any degree. I didn't talk about Moses in any of the videos, but yeah, it was just fun. It was an outlet of creativity that I really liked. Since I'm a left-hander that can't draw or can't do good art, at least I can, you know, film or do clever things with speech.
Now, would you extend your definition of a public health leader to Charlton Heston, who played most of
Let my people go! With my gun, my NRA, the NRA president. I'm a gun owner, so I guess that wouldn't go over.
All right, well, if anyone wants to throw a question into the ring.
What's funny about public health?
What's funny about public health? Some of the characters I met in public health are funny to me, and perspectives. One of my favorite funny men of public health would probably be Dr. Arthur Reingold. He's an epidemiologist. His dry sense of humor and his adamantly faithfulness to the Jewish tradition and faith, missing every Jewish holiday that's out in our class, is just, it's great. He's great. He's a great guy, and he's just funny. He just takes things lighthearted. He's seen so much with outbreaks that he's kind of like comes off cold-hearted, but at the same time it's humorous in class.
All right, well, we don't need to leave you swinging in the wind.
I think my mouth's dry. I need a drink.
That was great.